Now, I want your view on this. There's a leading economist, Saul Eslake, I'm sure you know him well, who says we should look at slugging unvaccinated people with higher taxes. So they should pay higher Medicare fees, for example. Saul Eslake argues that this would help repair the budget and ease pressure on the healthcare system. He's on the line, Saul Eslake, the leading economist. Good morning to you, Saul.
Good morning, Ben, and thank you for having me on your program.
Boy, you're going to be popular with the unvaccinated, aren't you?
Well, probably not, as I think we can all guess. And let me be clear, I'm not suggesting this is a way of repairing the budget, nor am I suggesting that any additional amount that the unvaccinated might be asked to pay should be a substantial amount. But rather, I'm drawing an analogy with a long-standing policy that I think was introduced by the Howard government, that people whose incomes are over a threshold that's currently $90,000 who choose not to take out private health insurance have to pay between 1% and 1.5% additional Medicare levy, the argument presumably being that although private health insurance isn't compulsory, people who can afford it but choose not to are in effect putting an additional burden on the public health system, and they should make some contribution to the cost of it. And that's all I'm suggesting in this case. I'm certainly not advocating that people should be forced to be vaccinated if they choose not to be. That's their right. But it seems pretty clear that vaccinations do significantly reduce the chance that you will become sufficiently ill if you manage to catch COVID that you have to go to hospital and require intensive care. And if you make the choice not to be vaccinated, it doesn't seem to me completely unreasonable that you be asked to make a small contribution to the additional cost you'd otherwise be imposing on taxpayers.
Yeah, I suppose there is an argument, and we know that the hospitals at the height of COVID were filled with people who are unvaccinated. Therefore, unvaccinated people are going to have a disproportionate level of pressure that they place on the health system, which we all pay for. Therefore, if people are making choices that are going to cost the health budget's bottom line, they could pay a bit more.
And that's really all I'm suggesting. I mean, you can draw other analogies. The Howard government also introduced a policy that people who don't get their kids vaccinated against a wide range of well-known childhood diseases like measles, mumps and rubella and so forth don't get childcare subsidies. Now, that's not the same thing as paying an additional tax, but it is getting less by way of support from the government. People who smoke, people who drink pay additional taxes. In the case of smokers, very substantial additional taxes through the excise that's levied on tobacco products and on alcoholic beverages. So, again, I'm not suggesting anything unprecedented here, and I want to emphasise that, I'm not even really thinking that this is going to prompt a lot of people who choose not to be vaccinated, as is their right, to get vaccinated in order not to pay a higher Medicare levy. That's their choice. But it does seem to me overwhelmingly clear that vaccinations, though they don't stop you getting COVID, significantly reduce the chance that you will have to go to hospital and require intensive care. And if you make that choice, I don't think it's at all unreasonable for the vast majority of us who have chosen to be vaccinated to say, well, you can pay a bit more towards the cost of your treatment. And that's really all it is.
Singapore has introduced a bit of a user pay system for people who are unvaccinated. So if you get COVID, you pay your own medical bills. Yeah,
and I think that would be tough on people on low incomes. Right? If there may well be people on low incomes who couldn't afford the cost. I mean, most of us probably couldn't afford the full cost of hospital treatment if we weren't covered by any form of insurance at all, whether it's Medicare or private health insurance. And that would be tough on low income people. And I don't want to be tough on people on very low incomes. And I'm not suggesting that people on low incomes should have fewer choices than people who are on higher incomes in matters like this. But, we have a system where the contribution you're asked to make to the cost of the health system is more or less proportionate to your income. And if you're in a position where you can absorb some of the costs through private health insurance and choose not to, then you pay a bit more. I think this is very much along the same vein. And it's not even as if it's administratively difficult, because everyone's vaccination status is now tied to their Medicare, card. So it wouldn't, I don't think, be administratively complex for the government to put this into place.
An interesting conversation starter, and I'm pretty sure that's all it is, but we always appreciate getting your point of view, Saul. Thanks for jumping on the line.
Thank you for having me,
Good
Ben,
on
again.
you. Saul
Appreciate
Eslake,
it.
the leading independent economist, and I think you can work out from Saul, he's not even proposing this as an idea, but it's a conversation starter. And one of the ways that we've encouraged people to get vaccinated is by putting some rules in place that make it unattractive to be unvaccinated. And one of the big ones has been saying if you don't get the jab, you're not going into certain places. And I think in the lead up to the reopening and summer, that has had an impact.